Deputy President Paul Mashatile has signed the second presidential health compact. This as President Ramaphosa continues to recover from an eye infection. The signing was delayed by pushback from health professionals and business. They want the National Health Insurance Act reviewed, saying it's unworkable in its current form. Mashatile insists the compact will improve the healthcare sector to enable it to implement the NHI. Now, he says improving access to medicines and vaccines remains paramount. The signing of the Presidential Health Compact will ensure provision of quality health care, whether in public or private healthcare systems. The Presidential Health Compact is a presidential initiative established by President Cyril Ramaphosa in 2019.
As we implement the NHI, we will build on lessons learned to streamline standards and ensure quality of care, whether it is rendered at a public or private facility. We need diverse expertise as we work towards strengthening health systems and building their resilience for the future. We need to share resources to ensure that programs are implemented. Involving the private sector, labor and civil society throughout this effort is key to ending inequality in healthcare. It is up to us to build on the successes of the first presidential compact. We need to ensure that the second presidential health compact that we are signing today is responsive to the challenges facing our health care system. To all our partners, we say, please keep up the good work, continue to demonstrate the progress that we are making and deepen collaboration so that we overcome these challenges. Our nation's health is too critical, too essential to development, to be weakened by mismanagement, funding crisis, or other problems. We expect all stakeholders to bring solutions and work with the Department of Health and Science and Innovation to implement them. Implementation is the foremost priority of this seventh administration. Program Director, I have full confidence that implementation is a priority of all of us as we are gathered here this afternoon. I therefore wish all of you well and hope that working together we will indeed succeed.
All right, let's bring in health activist Dr Kgosi Letlape now, who joins us via video link just to unpack the newly signed health compact. Dr Letlape, a very good afternoon to you, and thank you so much for your time. Perhaps the idea here, is to seek to strengthen the health system, appreciating, of course, that buy-in from various sectors of society, including businesses, labor, health professionals, and academia is crucial. So is the framework and the policy guide of the health compact clear in achieving this goal of a stronger healthcare system? I'm wanting to understand the pushback.
Well, the compact is a well-written document. But our challenges don't require a well-written document. Our challenges require decisive political leadership. The problem with our healthcare system is that we've learned that concurrency doesn't work. These 3 tiers of government has failed in terms of health. Provincialization, localization. For example, we have 10 national hospitals that should be brought immediately under the jurisdiction of the Department of Health. Health must be made a national competence. None of those critical steps are part of the discussions of the compact, because those are political decisions that require political leadership. When you look at the things that bedevil the public healthcare system, is employment that is inappropriate, that is not based on competence, where there's political deployment and people without skills being put into the Department of Health. What is needed there is to ensure that the Public Service Commission Act is promulgated, that employment of public servants reverts back to being the responsibility of the Public Service Commission. De-link civil appointments from politicians so that the president appoints the minister. The DGs are appointed by the Public Service Commission as senior civil servants. That will give them the independence and protection from political interference. And they can then be held responsible for proper procurement, proper maintenance of hospitals, proper resourcing of hospitals in terms of human resources. When you look at the compact, we look at 9 pillars, including human resources, including technology. But we've had so many human resource plans for health from the Department of Health, none of which have ever been implemented, that all this become talk shops when we know what the fundamental problems are. The key to fixing healthcare, the key to oneness, the key to a system that works for all of us.
Yeah, and I mean, Dr. Letlape, I want to draw you, in fact, I'm glad you mentioned implementation. Not too long ago, of course, in Parliament, you gave a very powerful speech. I want to draw on 2 matters that you spoke of. The first, the need to reform the private sector. And you also mentioned a health market inquiry report from 2018 that has not yet been implemented. And I want to talk about the latter. Just unpack what for you is crucial to start with in terms of the implementation of that report and its findings.
I think it would be important for people to know, in summary, that part of the destabilization of the private sector was done by the Competitions Commission in the early 2000s, where they prevented negotiation of tariffs, saying there's collusion. You've then created an environment where there are no price controls, and health has become unaffordable. So they've now come up with a commission report and the commission recommendation, one of the recommendations is that you must go back to a negotiated statutory tariff. And what people do not realize is that prior to 94, Medicaid aids offered universal health coverage to the members. But when the laws were changed and you could have your front tooth covered and your back tooth not covered, you could have a myriad of benefit packages that nobody understands. You've created the insecurities that you have in the private health sector. It has become too expensive, and the members are not guaranteed care, and the providers of service are not guaranteed payment. So some of the recommendations will begin to repair that serious damage that has been done. The current private healthcare system, the only winners in the system are administrators. The fees are exorbitant. Before, fees were kept. And those reforms are essential to make the private healthcare industry sustainable. When you're going to a model of insurance, you are basically privatizing public healthcare. You are not making it a public good, because you're going to have a purchaser, you're going to people that are going to define packages. It's contrary to the promises of universal healthcare. So we talk left and walk right. And that's the fundamental problem. So we don't need summits. This NHI, the Health Market Inquiry Report, is from 2019. 5 years later, why are we not implementing it? Coincidentally, when that report was made, Minister Motsoaledi was the Minister of Health at the time. He's come back, so he's fully aware of the issues of the Health Market Inquiry Report and its recommendations. So what we need to do is to look at HMI to fix private health and look at the glaring problems in public health and fix them.
And just on that note, just from a practicality perspective, knowing, of course, that some of these legislation that we are currently seeing now will take years before it's even practically implemented. But just from an alignment perspective in terms of whilst that is going on and looking at the pressure points, where do we even begin in bridging the gap between the wealth resource, the pricey private sector, which caters for around 16% of the population, and the public sector that caters for the majority of the South African population and yet is underfunded and poorly resourced?
This is a legacy of apartheid. And you must remember that the private sector exists because of apartheid legislation called the Medical Schemes Act. So it's an act of parliament. It's a funding for a sector of the community. Now, can you imagine that you have a promissory note that says, oh, when NHI is fully functional, medical aids can cover what NHI provides. That's a recipe for disaster. Because when the people that advocate NHI are getting their care from medical aids, which you don't need to be a genius, will be better run than NHI, and their health care is not where they take in the majority of the people, you are rearranging chairs on the Titanic. You can't have two funding mechanisms, two private funding mechanisms or privatized funding mechanisms from the same parliament and say apartheid is dead. That's the fundamental dichotomy that needs to be sorted out. I have said, I'm now a parliamentarian, and if we want health reform, there should be no palm head. As public servants, we should be mandated to use the public health sector with no favors. That's how you fix healthcare quickly. Not 6 years' time, not 10 years' time. Fixing our healthcare has become like the proverbial HIV vaccine, which is always 10 years away.
Dr. Letlape, thank you so much for your time. I really do appreciate it.